Animals tend to be aware of what is edible and what's not. Well, that generally tends to be true, but from our experience, some dogs just love eating things that they really shouldn't. I'm Teresa, I'm one of the directors here at Warren House Vets, and in this video we'll be sharing a few interesting cases we have had at the practice of dogs ingesting foreign bodies. Small objects like little stones or beads usually don't cause much trouble and eventually come out after a few days. As long as these objects are not sharp or dangerous like batteries, we can just choose expectant management. In other words, sit and wait. Larger things like toys, pieces of fabric, etc. can get stuck in the bowel and cause obstruction. The typical symptoms are tummy discomfort and pain, vomiting, which is not usually very responsive to anti-sickness medication, and as the obstruction progresses, the dogs become lethargic and very unwell. If untreated, it can lead to bowel perforation and ultimately death. The diagnosis of foreign body can be sometimes easy when we see the object on X-ray. Quite often the object is not radio opaque, meaning it's not visible as such on the X-ray, but paired with signs of bowel obstructions, we can also see distended loops above the obstruction on the X-ray. Ultrasound is limited, but sometimes we can see, for example, distended stomach or some other indirect signs of obstruction. Quite often the diagnosis is made based on the clinical picture and imaging, as well as history of scavenging and habit of eating the wrong things. Treatment depends on the size, location and complications from the foreign body. Non-sharp objects in the stomach may pass back with vomiting. Sometimes we can remove them endoscopically, that is with the help of a camera and special tools. When they are in the stomach, we pass this camera through the mouth and we can remove objects from the stomach. We have to operate when it's further in the bowel. This is done through midline laparotomy, which is an open cut in the belly, so we can check the full length of the digestive tube. Now let's have a look at some of the cases. In the past, we for example had a patient who ate a golf ball. This was clearly visible on the X-ray, and since it was causing obstruction, we removed it surgically. Another patient ate a vet wrap, which is the bandage we use. We had to open the bowel in 3 places in order to remove it in the full length. Another patient ate his toy, which was retrieved from his bowel intact. Dogs are really like our children, so keep an eye on what they eat, because sometimes they are just naughty and they eat whatever. Thank you for watching, and I'll see you next week.